Hello, I'm Jordan McCullough. Hey, I'm up here. I'm in the corner. I'll be up here the whole time that we're together. But thank you for signing up for our webinar, Medicare 101. We are going to be going over the basics of Medicare. I'm a licensed insurance broker specializing in Medicare and individual health insurance. We're located right here in the Mitten State, and we are experts at helping you understand what options are available to you and your spouse when it comes to Medicare and your health insurance as you maybe start to prepare for retirement. Like I said, I'm an independent insurance broker, which means I'm able to help you compare different plans that are available to you. Ultimately, my goal is to inform you, advise you, and to empower you to make a confident decision when it comes to your health insurance. A little bit about us. We are a father-son agency, meaning it's just the two of us that work here. My dad is Doug, the agency is named after him. I'm Jordan, I'm his son, I'm also an agent. Our process for helping our clients is the same. So whether you're working with me or with him, you're going to ultimately have a very similar experience. I hear from our clients all the time that we sound so much alike, and I think that is such a great compliment to me. So if you call into our office, it's most likely that it's going to be one of us who answers the phone. Both of us are very capable of answering your questions. We like working this way because it provides more continuity of service for our clients and helps to make sure that someone is always here to answer your questions. We also just like to be in business together, so it's a really good situation for us too. Like I said, we are independent insurance brokers, which means that we contract to represent multiple insurance companies, and we are able to represent the plans that the insurance companies have to offer. When you speak to me or my dad, you're not hearing about the plans of just one insurance company. We're able to bring you a wide variety of options from the marketplace. My job is to help you understand what choices are available to you and the implications of those choices. I'm also available to you throughout the year to answer any of your questions. The biggest misconception is that working with an insurance broker costs you extra money somehow, but that's just not the case. We do not charge you for our services, and there's no extra charge for using an insurance broker. We can enroll you in the same plans and at the same price as what is available directly from the insurance company. What is Medicare? So, Medicare is a federal health insurance program. It is for U.S. citizens and legal residents, and it is individual health insurance. It is not Medicaid, it is not Social Security, and it is not family plans. However, if you need help with Medicaid or Social Security, we still may be likely to lend a hand for you. A good place to start is if you are eligible for Medicare. You are eligible for Medicare when you are 65 years old or have certain disabilities or other special circumstances. You also have to be a U.S. citizen or legal U.S. resident who has lived in the United States for at least 5 consecutive years. When can you sign up for Medicare? You can sign up for Medicare during what is called your initial enrollment period. That is the 3 months before, the month of, and the 3 months after your 65th birthday, or the month in which you are becoming eligible for Medicare. If you do not enroll in Medicare during your initial enrollment period, there is a general enrollment period every year from January 1st to March 31st in which you can enroll. Additionally, if you have credible health insurance through an employer, you may be able to enroll in Original Medicare after your initial enrollment period without incurring a late enrollment penalty. There are also special election periods in which you can change your Medicare Advantage plan. These are limited to special circumstances that you do not typically encounter too often, like being diagnosed with a qualifying chronic health condition, moving to a new area, or qualifying for extra help. Finally, every year there is an annual enrollment period from October 15th through December 7th in which you can add, drop, or switch your Medicare Advantage coverage. Any change made during the annual enrollment period is effective on January 1st. When to enroll in Medicare is an important decision, and it can have long-term consequences such as late enrollment penalties and missing out on guaranteed issue rights for certain plans. We suggest that you schedule a one-on-one consultation with us for guidance during this process. The first step in your Medicare journey is enrolling in Original Medicare. Original Medicare is Part A and Part B. Generally speaking, Part A helps pay for hospital stays and inpatient care, and Part B helps pay for doctor visits and outpatient care. However, you can incur Part B expenses while in the hospital. So, how do you go about enrolling in Original Medicare? Well, if you're already receiving Social Security or Railroad retirement benefits when you are turning 65, you will automatically be enrolled in Original Medicare, both Parts A and B. If you are not receiving those benefits when you turn 65, you can enroll by calling Social Security at 1 800 772 1213 or by going online to ssa.gov. Most people find that simply enrolling in Original Medicare is not enough. As a beneficiary, you are responsible for a lot of the costs of your health care that you receive. There's also no coverage for prescription drugs if you only have Original Medicare. What most people end up wanting to do is to get an additional Medicare product to help cover their share of the costs. When you are making that decision, it's easiest to think of it as choosing between two options. Option one is staying in Original Medicare and purchasing a Medigap or Medicare supplement insurance plan and or a Part D prescription drug plan. Medigap plans have a premium, but most of the most popular Medigap plans pay for nearly all of your share of your costs under Original Medicare. Option two is to choose to enroll in a Medicare Part C or Medicare Advantage plan. When you enroll in Part C, Original Medicare is no longer the payer for your health care. Instead, the insurance company that you enroll with becomes the payer. So you still have to pay a share of the cost for your health care under Medicare Advantage. Like when you go to the doctor, you still would have a copay or a co-insurance, the same as with a hospital stay. But the Medicare Advantage plan is also paying for you to receive that care. There are pros and cons for both of these choices, and we are here to explore those with you. I hear all the time from my clients that they're going to sleep better tonight after they have a one-on-one consultation with us and they have an idea about which path they want to go down. Okay, let's break down the cost of Original Medicare. For most people, Part A is free based on the taxes that you or your spouse paid during your working years. When a hospitalization occurs, there is a deductible of $1,676 for each benefit period. If you are hospitalized for an extended period of time, there are significant daily copays that start to kick in. For days 61 through 90, the copay is $419 per day. After the 90th day, the copay goes up to $838 per day. For Medicare Part B, there's a monthly premium of $185 per month for 2025. That is the standard premium. High earners can end up paying what's called income related monthly adjusted amount, or IRMA. That's an increase on your Part B and Part D cost. There is also an annual deductible for Part B. It's $257. After you pay the first $257 when receiving Part B services, Medicare will pay 80% and you pay the other 20%. So Medicare Part A is for hospital care. It covers things like your hospital room, meals, general nursing and hospital services and supplies. It does not cover private duty nursing, comfort, or convenience items. It's important to note that the deductible applies to any new benefit period. So what is a benefit period? A benefit period starts on the day that you enter the hospital and it ends after you have been out of the hospital or skilled nursing facility for 60 consecutive days. If you are rehospitalized after 60 days, you are in a new benefit period and the deductible must be paid again. Therefore, it's possible that you could have to pay that deductible several times a year if you are hospitalized multiple times. Medicare Part A covers inpatient hospital care, skilled nursing care, hospice care, and some home health care. Note that during a hospital stay, you can also incur Part B expenses. Now let's dive into Medicare Part B. As I mentioned earlier, there is a deductible of $257 for the year, and that has to be met before Medicare starts to pay its share for these services. After the deductible, Medicare pays 80% and you're responsible for the other 20%. These services are things like ambulance services, chiropractor, doctor office visits, surgical services, Part B drugs, emergency room services, diagnostic tests and procedures, speech, physical, group, and individual therapy, chemotherapy, and radiation. There are some services that Medicare pays 100% of. These are typically things that are preventative in nature, as well as certain vaccines. There are some things that are not covered by original Medicare, such as prescription drugs that you would pick up at a pharmacy, hearing aids, routine dental, and eye care, and cosmetic surgery. Now that we've covered some of the cost of getting care under original Medicare, let's dive into your Medicare options. So I mentioned before, option one for dealing with the cost under original Medicare would be to purchase a Medicare supplement insurance plan or a Medigap plan. A Medigap plan works with original Medicare to help pay for some of the deductibles, copays, and coinsurance that are not covered by original Medicare. And by going with this choice, you receive the greatest access to care. Original Medicare is accepted by 98% of physicians in the United States, and Medicare supplements do not require prior authorizations, referrals, or limit you to a provider network. So as long as the service is covered by original Medicare, then your supplement will pick up its part. If you sign up for a Medicare supplement during your initial enrollment period, it is a guaranteed issue and guaranteed to be at the best rate. Choosing a Medigap plan during your initial enrollment period could end up being one of the most important decisions you make related to Medicare. When you sign up for a Medigap plan during your initial enrollment period, you do not have to answer health questions and you do not have to disclose pre-existing conditions. The plans are guaranteed renewable and the rates do not go up if you get sick. If you do not enroll in a Medigap plan when you are first eligible and then get sick later, it could be either difficult or expensive to find a Medigap plan that will accept you. While there are many Medicare supplement insurance companies, the plans are standardized across the industry, meaning Plan G will cover the same Medicare expenses no matter what company you go with. And many plans offer limited lifetime worldwide coverage if you travel abroad. All right, so now let's just briefly go over the advantages and disadvantages of a Medigap policy. The advantages is that it's accepted anywhere original Medicare is accepted. There's no prior authorizations for the supplement. However, original Medicare may require prior authorization in very limited circumstances. The most popular Medigap plans pay for all of your cost sharing under original Medicare, except for the $257 deductible and excess charges. The disadvantages is that there's no routine dental, optical, or hearing coverage. Prescription drugs that you would pick up at a pharmacy are not covered. You need to get a separate prescription drug plan for that. And there's no supplement benefits like what you would see with a Medicare Advantage plan. If you stay in original Medicare and purchase a supplement, some people also want to get prescription drug coverage. The plan comes into effect for any prescription that you would pick up from a pharmacy. Note that all prescription drug plans are required to have a maximum out of pocket of $2,000 per year, meaning the most that you would pay for your prescription drugs in a calendar year is $2,000. Although you are not required to enroll in a prescription drug plan, there is a penalty of 1% of the average monthly premium for each month you delay enrollment. If you choose to get a Medicare Advantage plan, there are Medicare Advantage plans that include prescription drug coverage. For those who qualify for a low-income subsidy, you may receive extra help with the cost of your prescription drugs. The income and resource limits are listed here, and the monthly income for an individual is $1,978 and $2,665 for a couple, with resource limits of $17,600 for an individual and $35,130 for a couple. And this applies whether you have a standalone prescription drug plan or a Medicare Advantage prescription drug plan. It helps to pay for deductibles, copays, and premiums for your prescription drugs. Okay, now let's dive into option two. Option two is Medicare Advantage or Part C. If you go with this option, original Medicare is no longer the payer for your health care. A private insurance company takes over your Medicare, and you, along with the plan, will be paying for your health care. When you go to get healthcare, you typically will be paying a co-insurance, a copay, or a deductible for receiving care. Broadly, there are two types of Medicare Advantage plans. There's HMOs and PPO. An HMO is when you have a large network of providers and you generally have to stay within that network for receiving care. A PPO is also a large network of providers, but you have the option of going outside of the network if the provider agrees. However, typically a PPO plan doesn't have as rich of benefits as what you will see with an HMO. There are advantages and disadvantages to enrolling in Medicare Part C. Some of the biggest advantages are that there are many Medicare Advantage plans that have no monthly premium. However, you still have to pay your Part B premium. They offer many extra benefits such as dental, vision, and hearing, and some plans have over-the-counter benefits and gym memberships too. Any service that is covered by Original Medicare is also included in Medicare Advantage, and many plans also include prescription drug coverage as well. Original Medicare does not have a maximum out of pocket, so enrolling in a Medicare Advantage plan limits how much you could pay in a year on healthcare, and you do not need to purchase a Medicare supplement plan. Some of the disadvantages is that insurance companies can require prior authorizations for many services that would be routinely covered under Original Medicare, resulting in care being denied. Medicare Advantage plans do limit you to a network of doctors, and getting care out of your network can be expensive. Medicare Advantage plans also tend to change from year to year and should be reviewed annually. If you have an unlucky or an unhealthy year in which you are receiving a lot of medical care, you could reach your maximum out of pocket, which could be an average of around $6,000. Another disadvantage is that you cannot purchase a Medicare supplement to cover the cost. This is an either or situation, so you really are needing to choose between a Medicare supplement or Medicare Advantage. But we're here to help. Okay, I mentioned prior authorizations as a disadvantage for Medicare Advantage plans, and I just want to take a moment to look at and kind of show you what the numbers look like in terms of having care denied. And what we're seeing is insurance plans are increasing the use of prior authorizations, and there's also been an increase in those prior authorizations being denied. For the year 2023, the most recent year that data is available, there were nearly 50 million prior authorizations across all Medicare Advantage plans. That's up from 37 million in 2019. And in 2023, the denial rate for prior authorizations was just over 6%. Having care denied is stressful and scary, and it results in care being delayed and interruption of your treatment plan. And it's almost a guarantee that at some point you will encounter a prior authorization on a Medicare Advantage plan. I don't say this to scare you or deter you from Medicare Advantage. There's a lot of situations where we recommend Medicare Advantage plans, but we just want you to be aware of this as you make your choices. I also just want to take a moment to call out that there are some Medicare Advantage plans that are special needs plans that you can qualify for if you are eligible for Medicaid, if you have a chronic illness, or for certain institutionalized individuals. Not everyone qualifies for these plans, and they are specially tailored to serve those populations. The Inflation Reduction Act was signed into law in 2022 and phased in parts over the past few years. In 2023, we saw coverage for certain vaccines for adults, as well as a cap on insulin cost. In 2024, they shifted some of the cost for prescription drugs from the enrollee to the plan. And in 2025, there were significant changes, including setting a maximum out of pocket for prescription drugs at $2,000. There was an elimination of what was known as the donut hole, which was a cap on prescription drug coverage when the beneficiaries have paid a certain amount of their prescription drugs. There's also a new Medicare prescription payment plan program to help spread the cost of prescription drugs out over the course of the year. This is administered by the plan, and you should consult with the plan before deciding whether or not to enroll in it. Other changes that were implemented this year were designed to shift some of the cost of prescription drugs off the beneficiaries and back onto the plans and drug manufacturers. Okay, finally, just to kind of bring everything that we talked about for full circle, let's take it back to the two options that we discussed at the beginning and that we've gone over. Option one is for your Medicare is that you stay in original Medicare and that you add a Medigap plan, prescription drug plan, or dental vision and hearing. This really does provide you with the greatest access to care during the years in which you are most likely to need the most health care. It is accepted by all providers who accept Medicare, and Medigap plans do not require prior authorizations for Medicare covered services. If you enroll in a Medigap plan during your initial enrollment period, you do not have to answer health questions, and it is guaranteed issue at the guaranteed best rate. Option two is Medicare Advantage, where a private insurance company becomes the payer for your health care. When a private insurance company is paying for your health care, they also have the right to utilize prior authorizations and to deny care. They can limit your care to a network of providers. However, there are benefits to Medicare Advantage, like no monthly premiums, dental vision and hearing, prescription drugs being covered and included in the plans. All right, thank you for watching. You probably have questions about your personal situation, and I encourage you to reach out and schedule a one-on-one consultation. I'm Jordan McCullough, helping people understand Medicare.